AWP Voices, your people promise in action.
Welcome to the second edition of AWP Voices with me, Steve Walker, and Katie McManus. Katie will be here a bit later to tell us about the People Promise programme and how you and your team can get involved in this podcast series. In this episode, we're focusing on child and adolescent mental health services with our guest from Bristol's Thinking Aloud, Dr. Megan Yakeley, a child and adolescent psychotherapist. Megan was an award winner in 2024 in a clinical category for making a difference. She developed a model to support children in care who are neurodivergent and who've also been exposed to trauma. So Megan, welcome to AWP Voices.
Thank you so much.
And to begin with, can we begin by talking about what is Thinking Aloud?
So Thinking Aloud is a specialist CAMHS service, and we exist to support the mental health needs of Bristol children in care, or any child in Bristol that is on a care order or is living with adopted parents, basically is not growing up with their birth parents. Our role often starts with the whole of the network around the child before we meet with the child. So we will often start with a meeting with the social workers, with the foster carers and any other key adults involved in the child's life to get an understanding of what the difficulties for the child are and to plan together what the appropriate intervention might be. And often the work that we do remains with the adults in the network, and we don't see the child and we never meet the child because everything we know about children who've had disruptions to early life and disruptions in care in their early lives is that the people who are providing the care now are the ones that need to form the relationships that will help them develop and grow in the way that we want them to grow. So Thinking Aloud's role is often to support those adults to do that job.
Does it often feel you're providing support, but somehow is one step removed? You're one step back?
That's a really interesting question. It doesn't always feel like that because for us, the service users are the whole group. So we will, for example, having gone on from the initial meeting that involves everybody, we might decide that part of the care plan that we're going to offer is, or the whole of the care plan we're going to offer is solely support for the foster carer. Now, again, they are doing the hard work and we're supporting them to do that work, but we're also giving them the knowledge and the skills and the understanding of why the child's behaving like that and what interventions they can do that might help, how they might respond in a certain way that would help the child. And again, developing that relationship between foster carer and foster child is far more important than developing a relationship with somebody like me and the child. Because I'm not going to be in the child's life forever, and we want the foster carer to be in the child's life as near to forever as you can with foster care.
So if you were a foster carer, what would support feel like if you came to Thinking Aloud?
I'm not sure I could answer what it would feel like, but I could explain what it would look like. My hope would be that it would feel very supportive and containing because we offer a place, as a team, we offer a place for foster carers to bring how they feel and the difficulties they have, and we want it to be a safe space so they can say when they have negative feelings, so that we can explore those negative feelings and help them with that so that they can look after the child and not get swamped by their own negative feelings. What it often looks like is we might meet with the foster carer on a monthly basis and talk through what's happened in the last month and ask what's gone on and what their responses were to the child's behaviour, talk through what they think is behind it, and then think about what else might help, what interventions might work, in this case, for this child and this foster carer. We also offer a lot of training to foster carers, and we link up with a parallel service that's hosted in Bristol City Council called BTSS. There's a parallel service called BTSS, and they also offer support in a similar way, and they do the training in a similar way. So it's all about the skills that the foster carers need to provide a safe, nurturing environment for that child to grow, and it's all based around attachment theory. That's the core model of children in care and how to support them.
What is attachment theory? What does it mean to have attachment issues?
So attachment is a model of how we form our relationships in our early life and how those relationships inform what we see about the world. So a securely attached child understands that adults are there to help them. They understand that they can go and explore in the world. But if they have a difficulty or a problem, they can come back to their primary carer with whom they have the secure attachment for reassurance and comfort, and then they can go off and explore the world again. So a healthy child does both. They know who their primary carer is, they have a strong attachment to that primary carer, and they come to them when they need it, but they can also feel safe enough to explore. A less healthy attachment is when the child either feels too scared to explore the world and has to cling to the parent, or doesn't feel the parent is ever there for them at all, and then essentially turns their back on the parent and never comes in when they're hurt. So they don't ask for help when they hurt themselves. They don't talk about their difficulties to anyone. They don't think adults can help. So they're two different ways of insecure attachment presenting themselves.
So when you're developing your services at Thinking Aloud, how important is it to have the child at the centre of what you're planning?
That is absolutely essential. Everything we do has the child and our understanding of the child and the needs of that child in the centre. And sometimes things can get so difficult for foster carers that they lose sight of what the child's needs are, or they can become so challenged by the child's behaviours that their own responses take over, and they forget that behind those behaviours are emotions and difficulties that the child isn't coping with very well.
Now, you work with children and young people who are both neurodivergent and have also been suffering from trauma as well. So what is a combined impact of being neurodivergent or autistic and also suffering from trauma for a young person?
The combined impact is something that is not well understood, and I wish it were. The focus has always been on attachment and difficulties with attachment, which stem from disruptions in consistent care, which is part of what forms developmental trauma. So the result of experiencing developmental trauma through disruptions in care is you have difficulties with attachment to people. And the focus has always been on that model. And so the idea that it was also possible to be neurodivergent as well as experiencing developmental trauma is actually quite a sort of, I want to say, a new one, or it's a new way of thinking, because previously there was a belief that you had to be one or the other. And that stemmed from the fact that the presentation of the two is very similar. A child who has been developmentally traumatized and a child who lives with birth-present parents, has not been developmentally traumatized but is autistic, can often look very similar in their behaviours. And so there was so much focus on trying to work out whether it was one or the other that somehow got translated into it has to be one or the other. So the belief grew, and this isn't in health services, it's a sort of across, I come across it in schools, I come across it in parents, I come across it in a broad range of settings. The belief is, he can't be neurodivergent because he's experienced trauma. And so I spend a lot of time saying, well, actually, they're not mutually exclusive, and even more, there is now a big evidence base that you are more likely to be neurodivergent than if you live in your birth family and have never experienced any changes in care.
And how does being exposed to trauma, also being neurodivergent, what impact does that have on potentially a child's placement succeeding or not succeeding as well as it could?
That's a really key question, because what we are seeing is that children whose foster placements continually break down, and the cycle of new placement, it going well, it going badly, breaking down, new placement, it going well, it going badly, breaking down, that cycle gets shorter and shorter until the point comes when there are no more foster carers available to try, and the child ends up in a children's home, often out of area, often quite expensive. There's a pattern, even those children's homes keep breaking down, that we're now realising that pattern often means there's undiagnosed neurodivergence going on. Because when the neurodivergence is recognised, we can divert the pattern and divert by offering different support, different resources. Everything changes once you know that neurodivergence is there. When it's not been recognised because the focus has always been on the trauma and the attachment, that pattern carries on. And for councils, it becomes really expensive. That, for me, is not a motivating factor. For the child, it becomes more and more distressing. That pattern of breakdown reinforces every single time, not only that no one can love them, but they are generally bad children, and they don't deserve to be here. I mean, that's essentially the core message that they get every time the placement breaks down. And it breaks down quicker and quicker because they know it's going to break down, so they'd rather preempt it breaking down than wait for the point when it's going to. The anxiety of waiting is worse than just making it break down.
So you developed a model, didn't you, to support children who are both living in care, who've been exposed to trauma and are neurodivergent. So how do you go about developing that model?
I went about it incrementally originally because I realised that these children were largely invisible and their foster carers were struggling. And at the very beginning, I was able to suggest running a training course for the foster carers. And that was all it was at the very beginning. It was a training course. And back then, this is the 7th year it's run. Quite short. I think it was only 2 days. And I just explained some of the basics, the overlap, and how to respond to the difference. So where the techniques they'd all been taught for helping a child with attachment difficulties, where they didn't work and why they didn't work and what you could do differently. And it was very well received, and those foster carers said everybody else should come on this, and more importantly, our social workers should come on it too. So it began from there, and it's developed now into a course that I run every year. It's 5 mornings across 5 weeks. I do it on Friday mornings in the autumn. And in that course, we cover the basics of what's going on for the child. But we also, and this is a really key part of not just what I do, but also the whole of Thinking Aloud, we cover what's going on for the foster carer or adoptive parent or the non-birth carer involved. So we cover the needs of both. And that's the part, I think, that really resonates with those who come, because we spend quite a lot of time talking about how hard it is for them, and I give them reasons for why it's so hard, what the child is doing and how it impacts them, why it impacts them, and then things they can do to look after themselves. And it's not you need to look after yourselves. It's these things are things you can do, mostly connecting with other people who understand. That's how we try and manage. So it developed from there, but there are 3 parts to it now, and they're all equally important. You start with the course, which is the understanding, because one of the things about caring for this group is that when you form a relationship with another person, relationships are usually reciprocal. And this group is not very good at the reciprocal part. So you give lots of empathy and the child doesn't return anything. So you end up being drained of empathy. And when you're drained of empathy, that's when you start not being able to care for somebody. So we talk about empathy reboot, which is you have to go away and reboot your energy like you would reboot a computer that wasn't working. It was a very lovely adoptive parent at the very beginning who came up with that term. And the ways that you reboot empathy, there's 2 ways. You remove yourself from the child so that you've got a break, and you reconnect with understanding. So you put yourself back in that child's shoes. So that's where the content of the course is really important. You remember, that's why they're doing that. And then you reach out to another adult who can give you some empathy back. So you connect with others. And that's the way that we look after the parent or carer so they can then go back in. And so that's a key part of it. And so in order to cover that part in our 3-pronged approach, we have monthly, what I call drop-ins, which are online sessions for any non-birth parent or carer of any sort within the AWP world. And they just rock up, they get the link, and they log on, and I ask, has anybody got any issues you want to discuss, or shall we have a general discussion? There was one that happened this morning, and there were no particular issues, but we had a general discussion about just how hard it was. And at the end, somebody this morning said, this has just really helped because I was feeling really down, and just sharing that has helped so much. So they're a very, I want to say, low-cost way, because I spend an hour and a half with them, and I just talk to them. Mostly I listen. That's the key. And they are so vital for the parents and carers that are struggling. The third arm I don't have anything to do with, but I help set it up, is that they have separately got a support group. And they are, again, it's a support group for foster carers, adoptive parents, SGOs, any non-birth carer of a child in this area that is also neurodivergent. And that's, again, part of connecting with others. It's the key to rebooting your empathy, connecting with people who understand just how hard it is. And it's impossible to explain quite how hard it is to do their job unless you've been through it. It's unbelievably difficult, and sometimes there's just no end in sight.
So what message would you give to parents of a neurodiverse child?
That is also a really good question. I think parents and carers, any parent or carer of any sort, birth parents, anybody, of a neurodivergent child, again, of any sort, my message would be that it's not just the child that needs support, you need support. And that if you can find others to connect to that share your experiences, it will really help. If you can find services, there are services in every area, and I know about Bristol ones, that are either charities or private organisations or local authorities or health services like ours. There are services everywhere that can also connect you in different ways. I think Facebook is one of a number of ways you can find out sort of local groups of parents that are also sharing their experiences. Do
you need a GP referral?
You need a GP referral to reach a lot of services within an organisation like AWP. You don't to reach a lot of the other services. The ones that require the GP's referral, they're going to be focused on the services for the child, the needs of the child. The needs of the parents have to be found in a slightly different way because they're not included in that quite often. And I think that's my hope for future support for all families with neurodivergent children, is that there is more put into the needs of the parents and supporting the parents, because they're doing the work of looking after the children. And that applies to all the children we see in Thinking Aloud. That's the model for Thinking Aloud. I would like that for all parents of neurodivergent children.
Dr. Megan Yakeley from Bristol's Thinking Aloud, thank you.
Thank you so much for having me.
Here's Katie to give us an update on the People Promise programme.
Thanks for having me back. It's lovely to come back and to hear from another guest. So the People Promise programme started at the beginning of April, and we've now started off 8 different projects. So each of them are at different stages, and our Our Space page has been updated to add details of all of those different projects, who's sitting in the teams, what the aims of them are, and how they're hopefully going to lead to a better staff experience for everyone at AWP. One of the strands of the People Promise is we are recognised and rewarded. And we do have some things in place. We've got things like our recognition awards. We also have our Pride in AWP circular. And as time goes on, it's great to see such a wide range of different people's names and the examples of what it is that they're being thanked for. We introduced at the beginning of this year Team of the Year for each division. And again, the winners of those are being published in the Pride in AWP circulars. And again, it's great to see a really wide variety of teams being recognised. We have our annual awards, of course, of which Megan is one of our award winners this year. And we also have our AWP long service milestone cards, which are being issued, and some celebratory events that are coming with the trust. But actually, it's not just the formal setup things. It's the things that are happening around the trust. It's the work itself. It's interesting work that people are doing that they feel really makes a difference to themselves, their colleagues, the service users, and the patients and carers and families that work to support those service users too. And listening to Megan's interview, it really got me thinking about how does the work itself actually lead to that feeling of reward? Does it elicit a sort of intrinsic motivation within you?
I think I was not consciously aware of that. So my answer is sort of reflecting back. I'm very motivated to promote the existence of this group, both the children and their carers, and try and promote services that would help them. And it is very motivating to receive feedback from service users in any context. So when they have said this has really helped, it is very motivating. And they've said that in a lot of different ways. And the advantage for me, in a way, is that I've come along and offered something that has helped where a lot of times they haven't had anything that's helped. So I get lots and lots and lots of feedback of this is really amazing. One of the adoptive parents at the very beginning wrote on the feedback form for the training, in 17 years of seeking help, this is the first time I've met someone who actually understood. So it is really powerful to hear those words. It's quite humbling to hear those words, to think that adoptive mother, those adoptive parents hadn't been able to find help for that long. And I would prefer not to receive that because they had actually got it earlier. That would be much better. But they are saying that, and it does help. And I take all of the feedback that I get really seriously. So everything that I do, there are feedback forms, and there's questionnaires they can fill in. And every suggestion that they make, I try and see if I can accommodate it into changing the course. The course changes every year. And the questions are designed so that they can tell me what they felt about it. And it's almost always positive. I have a consistent 9 out of 10, 9.5 out of 10 across all of the years because they find it so helpful and useful. And yes, that is motivating.
That must really give you a big sense of reward, and presumably the recognition too that winning the annual award and also being one of the finalists in another category this year, that's given you a platform. Coming along today, for example, to be able to talk about your work, the work of the service, and to have that public recognition as well as that personal reward.
Yes, the public recognition part is useful because it leads to this kind of thing, and this gives an opportunity to talk more about this group, and which is what I care about. As far as the award went, when I was nominated for what turned out to be 2 categories, when the categories close, when the nominations close, all of the nominees get what has been written about them. It gets sent to them. And the day that happened, and reading those, I was in tears because they were such lovely things to read. And at that point, I was quite overwhelmed by how much people were appreciative of my efforts to help them. But it felt like I'd won. So the award ceremony was amazing, and I really enjoyed it. It was great to be there. But it was kind of, I don't really care what happens because I've already won.
Yeah. And you're not the first to say that. We had a lot of feedback when we sent the nominations around to people saying just how much that meant to them to hear it, particularly when those nominations came from from patients, from carers, from service users, but also we had people receiving nominations from people they didn't work with that often, but whose work had impacted on them and made a difference to their day, to the way that they worked. And really that's what we're trying to push in this programme, is that cultural shift towards thanking people and actually saying when something they've done has made a difference, because we can't just assume they know it. And actually it's lovely to hear it. It makes you feel that it's all worthwhile.
Yeah, I completely agree. I'm a huge fan of telling people I really like that, or I really appreciate that. My team know that because I'm always emailing one of them going, I really like that you did that, or you've written that really nice whatever, or I really like that. And I guess maybe some people might not like that, or maybe some people might think I'm accidentally implying something else. I don't know, but I think it's just really, really important. I think perhaps we have a culture broader than AWP, maybe our country, that isn't very good on recognising people on a day-to-day basis, just that casual, well done. I think of, perhaps somewhere like America where they have that phrase, good job. We don't have that culture often of saying, oh, that's brilliant, well done. And I think it's great that there's this initiative to push that and to try and get people to say this is great, and to give the opportunity to service users, in my case, foster carers, social workers, adoptive parents. They were the ones that all wrote in to say, this is what Megan's done, and it's really made a difference.
And can I extend my thank you again today for you for giving up your time, and congratulations as well for the awards you were nominated for and won earlier in the year. It's been a pleasure to have you here today, and thank you for supporting our work.
Thank you so much. It's been an absolute pleasure to be here.
Thank you for listening, and if you'd like to take part in future editions of AWP Voices, please get in touch with Katie McManus. You can email her via katie.mcmanus1@nhs.net. We'll be back again in September. Until then, have a great summer.